Now, at this time, I'd like to turn the call over to your host today, Mo. Mo, please go ahead.
Good morning, good afternoon, everyone. Welcome, ladies and gentlemen, to our latest webinar in the series of Pharm-Olam webinars on key clinical research topics. The subject matter for today's webinar is rescue studies and how best to implement an efficient handover between two CROs. We will be focusing on lessons learned from our experience in taking charge of struggling studies midway through the process. My name is Yamin Mo Khan, and I'm the Executive VP of Clinical Development at Pharm-Olam, and I will be the moderator for your session. Our subject expert today is Alexander Yarashukevich. He's based in Kiev in Ukraine. He has an MD and a PhD with over 17 years of experience in clinical research, with 13 of these in project management and 5 years with Pharm-Olam. Alexander has got extensive experience in conducting clinical trials, especially conducting rescue studies in Central Eastern Europe and wider arena. So what we will cover today, I'll briefly give a short introduction on Pharm-Olam, then we'll go through on some of the key reasons why a rescue scenario is required, why a sponsor does decide to take a study from one CRO and hand it over to a second CRO. And then Alexander will in detail go through the handover process and what that entails. We will follow that up with the key action list on rescue studies, followed by conclusion, and then a Q&A session at the end. So a couple of words about Pharm-Olam. We are a privately held CRO with 27 offices in over 40 countries, conducting trials across 65 countries. The slide you see here, the darker blue countries are the ones covered by Pharm-Olam full-time permanent staff, with the yellow dots representing Pharm-Olam offices. When it comes to rescue studies, Pharm-Olam has conducted over 75 rescue trials across 39 indications in all phases. We have recruited just under 12,000 patients across almost 1,600 sites and 51 countries. We have rescued small local CROs, mid-sized regional CROs, and the majority of the large global CROs. And for full disclosure, I can state that Pharm-Olam has been rescued only once in its 22 years of existence. It is well known that the majority of the clinical trials that currently are ongoing or have been initiated in the last 5 to 10 years are late. 80% of all trials are delayed by 1 month, and the top single reason is patient recruitment. As you can see from some of the metrics shown in this table, 30% of the sites recruit the majority of the patients, 20% are average performers, but I guess most alarmingly, 15 to 20% of sites never enroll a single patient. It is estimated that a delay of 1 day in a trial costs the sponsor around $8 million. Of course, there are a number of reasons why delay could occur. Normally is one, but startup period, regulatory and quality issues are some of the others. And I will talk about some of the key reasons for rescuing trial. Most rescue scenarios fall into 3 categories. Supplementing of services of the current CRO, for example, adding new medical monitoring services to an ongoing study, adding more countries or adding more sites to an ongoing trial, thereby increasing patient enrollment and bringing the study in early, or a complete takeover. This, of course, is the most challenging of the scenarios and the one we will be focusing on today. We have also illustrated some of the reasons why a sponsor may instigate a rescue scenario. In the past cases, we have rescued studies for a number of reasons. Some of the examples include the incumbent CRO failing to obtain a regulatory approval in a given country or in a given region. We have rescued a study from a CRO that has failed to assign a project manager to the study for over 8 months. We have rescue studies where the startup has been delayed either due to lack of local presence in the area or lack of resource or lack of knowledge. We have taken over studies from CROs who have gone bankrupt or have upset the sponsor by issuing too many change orders. On some occasions, the quality of staff, especially the CRAs, have led to the sponsor seeking a transfer of the study to us. The transfer of a study from one CRO to another is a complex and a stressful process. If you are in a situation and you are considering and thinking about transferring a study from your current CRO to a new CRO, my first recommendation will be not to do it. Because the first thing you need to do is to explore all avenues with your current CRO before making that final decision. You really have to ask yourself whether changing the CRO will actually make a significant difference. You have to bear in mind that the protocol and the patient population will still remain the same irrespective of which CRO you select. If, after all this, you still decide you want to transfer the study to a new CRO, then you need to be fully committed. This just not includes you, but also your senior management, because during the transition process, you will go through some of these points illustrated on the slide, but there will be times when you may be in a position to regret what you've done. So you really need to be fully committed to be able to see the long-term benefit of transferring the study from CRO A to CRO B. The sponsor plays a really pivotal role in the transition process. So we have created an attendee poll, and we would like your input on what would be your biggest factor when considering a rescue study. A, poor recruitment. B, going over budget. C, poor study management. D, quality issues. We would like to get your opinion on why you would consider a rescue scenario. So I'll give you 15 to 30 seconds to consider these options. In the meantime, as you consider this, I will be handing over the presentation to Alexander, who will be talking about the handover process. So let's look at the results. I think there's some issues with the polling question, so I'll move forward and come back to the results at the end of the presentation. So, Alexander, please go ahead.
Okay, thank you very much, Mo, and hello, everyone. It's my pleasure to deliver our great experience in rescue studies, and I will appreciate your questions. So, we already shortly discussed about the reasons for the rescue studies, and I would like to reiterate that it's very important to perform root cause analysis in the very beginning of the factors which led to the need for rescue. It's important because our action plan will greatly depend on our findings, on factors which we identified, which contributed to failure of the study. For example, if it's financial issues like due to frequent requests for change orders or hidden cost, then it's going to be easy task for new CRO, just to make right. If it's processes and quality issues, including enrollment, then a lot of changes and work will be required, in that situation, and a very experienced team will need to be assigned, to that task. If it's about resources, lack of resources of CRO, again, might be easy if we are only at the initial stages of the study. You just need to put right people in the right places. But if it's an advanced development of the study, then it might be also impacting quality. Then again, much more work needs to be performed. Okay, assessment of the current study status. The first thing we will try to understand along with reasons for rescue study. It does sound obvious, but it may be really very difficult to do. And this is primarily due to fact that outgoing CRO may not be cooperative, and we observe this quite a lot. To avoid such a situation, not to be at mercy of CRO, sponsors should really provide proper oversight throughout the study, which is actually needs to be a requirement. I appreciate it may not be possible in all cases. For example, for really kind of huge studies with a big scope, with many countries, etc., when sponsor delegates a lot of responsibilities to CRO. But even in that situation, when you feel things are getting off track, and when you observe already major issues, then try to identify a resource and try to get to be more involved in project oversight. Also, what can help to keep an eye on the study, and especially if you need to rescue to hand over study, is to use proper tracking tools. Obviously, CTMS would be the best. Extensive use of CTMS systems. We often use Excel spreadsheets for tracking, which is also fine. But advice here is to keep Excel trackers on shared drive with anytime access for everyone. Another advice to sponsors would be to request CROs to send them ongoing regular status reports, comprehensive status reports. Not to expect updates during teleconferences, but to have full information beforehand, because update during teleconference is may not be well taken, and the minutes obviously don't take information in the end. So to keep information, the documented status reports kept on shared drives would be the best. In case when you come to the point of rescue study, when you would like to transfer study to another CRO, don't rely on new CRO completely. That it will be able to obtain information about current status very quickly and effectively. This is obviously the task, an objective of new CRO, but like I mentioned already, it may be difficult due to outgoing CRO be not cooperative. And it's not only because of outgoing CRO is upset about the fact they are resigned, but it's also because they might try to hide ongoing issues which are not resolved, which are still closed, which are still opened. And again, that's quite frequent observation we had. In terms of assessment of study status, what is important to understand before putting any plan forward? This is obviously operational status on all activities as per scope. This is documentation, including contracts, and I will speak about documents a bit later. We need to have full information about safety. If you have safety, if is reported. We need to have also a full picture about SDV and IP status. That's critical information you need to be aware of before we have a study. Also, it would be ideal to have full access to and to be aware about all current issues and all risks identified by former CRO. So, to achieve this goal, as communication between sponsor, outgoing CRO, incoming CRO, and vendors is very important here. Okay, once we perform study assessment, we need to create action plan, and for this purpose, we create a document called handover plan. Handover plan is not in lieu of proper final project plan. But it serves like a plan, kind of road for the handover period. Despite it has many common attributes and content like proper project plan, like you can see on the right-hand side of the slide. The main difference between these plans that handover plan is very short, concise, and focused on the handover process, handover activities only. Okay. Also, what is important, handover plan, preparation of a handover plan takes just a couple of days, and then we need to go to kick-off meeting straight away, which will be based on this handover plan. So timing is also very important here. So therefore we prefer to create this short, concise, focused document first. Okay. Communication is always key for any study, key for success in any study. But in rescue study, it's even more critical, as it may involve sometimes very sensitive communication between sponsor and new CRO on the one hand, and outgoing CRO on the other hand. Like already mentioned, the role of latter, of outgoing CRO, is very important during this kind of a stage. After we assessed this study, we need to have a clear plan, clear understanding on what information we need to receive from outgoing CRO during short period of time it will stay in the study. The responses from outgoing CRO should be preferably in writing, but we also need to set up several teleconferences to be able to ask additional questions, to raise queries, and to get clarifications on some other issues, and also ask some new questions which may appear on the way. In terms of communication, we need to be aware about really very limited opportunity window for communication with outgoing CRO. So we need to do our best to get as much information as possible during this period. And advice for sponsor is really to be very prudent in communicating to CRO that is going to be resigned. So advice is to be well prepared to this point, because the interactions, because cooperation will be maybe very much different after the point CRO is informed about resignation. So advice to sponsor is to do a lot of preparation work before triggering a handover process. Sponsor should try to understand fully the current status, to get access to all documents, to get originals if possible in-house, etc. This can be also done with help of new CRO already at this stage, this planning, and that's actually preferable. The same about termination of communication and cooperation with outgoing CRO. I appreciate sponsor cannot afford this kind of period to be alone due to financial reason, but it should be reasonable enough to be able for sponsor and for new CRO to be able to get information about the study, to be aware about the status, to be able to reconcile documents, to reconcile site contracts and payments, to be able to sign new contracts with vendors, where it's applicable, and also very important to notify regulatory authorities and sometimes to receive confirmation from authorities they are kind of approving zero change in the country. And also, we need to be fully aware about situation at the sites, to reconcile SDV done and to reconcile status of investigational product. So the planning for communication is very important. We also need to carefully plan communication to other parties about zero change. It involves sites, vendors, and regulatory authorities and ethics committees. We need sponsor need to what change in zero will involve. So in some countries, for example, when you change zero, you need to you may not just notify regulatory authorities, but in some countries you need to get approval from authority about zero change. Obviously, in latter case, it takes some time, so we need to plan that the outgoing zero should stay during this period of time. In terms of sites, we prefer that sponsor contact sites, inform sites directly about zero change, and then zero following with the sites with phone calls. This is preferable because we will be absolutely sure the sites are informed about zero change, and the sites will receive new contact for any issues they may have. Obviously, the new server may not be very helpful initially to solve the issues, but at least sites will not be left like unattended, will not feel like they're abandoned. Again, because outgoing zero may not be already that cooperative and not be already that efficient in site management. In terms of vendors, as soon as sponsor communicates to vendors, we need to follow up with new contracts. Again, if contracts between vendors were between vendors and outgoing zero. In terms of timelines, it's really very difficult to keep original timelines unless rescue is performed in the right moment. This is obviously the preference of each sponsor to have to save original timelines, but there are a lot of objective factors which may not allow this to happen. Especially if time wasted on some activities where catch-up is hardly possible. For example, if time lost on preparation to regulatory submissions, if time is lost on system setup, etc. Timelines can be saved also if handover process is smooth, and again, it depends on outgoing zero. There are also cases where saving keeping is very much possible. For example, if enrollment is delayed, putting right site management plan, recruitment plan in place, the enrollment can be catch up. Right site management, site motivation can boost enrollment if site has potential. If enrollment period is long, we can also bring new sites, new countries on board, and increase enrollment, thanks to those. In case of quality issues, again, timelines can be kept the same, provided that we have enough resources and we can deal with challenges and with issues, with quality issues and with new challenges in the same way. Okay. Documentation in rescue study. This is very difficult and very time-consuming tasks to accomplish. We need to start working on documentation reconciliation as soon as possible. And for this, we should have really clear plan. We need to clearly understand the first of all, documentation is kept in electronic or in paper format or in both. Then where it is kept, if it's electronic format, so obviously it most likely it's eTMF, then it should be just proper training and access provided to new team. If it's paper, we need to identify location, and again it may be really big surprises here. It may be not always clear where documentation is kept, so we need to develop the transfer plan, how documents will be sent, and timing for it. Then obviously reconciliation and QC of documentation should be provided. From our experience, it's possible to reconcile, to review, and to QC all documentation while outgoing zero is still participating in the study. So therefore, we need to create kind of a priority list of documents we need to review first. So this is going to be regulatory submission and approvals documents, insurance, site regulatory documents, site hospital, site contracts. And we need to review latest site monitoring visit reports to understand the situation of the site on critical activities, on safety information, SDV status, and investigational product. Okay. And I would like to specifically speak about site contracts. In case initial contracts were between sponsor and the sites, that's ideal situation. So there is no need to redo contracts. It might be some additional amendment required to indicate the new CRO. But if contract was between CRO and the site, which is more often more common practice, then we need to prepare a new contract with the site between new CRO and the sites. Obviously, sites will not be happy about about it, because of need to do negotiations once again, with different CRO and with different in place, and which and with some sites it takes a lot of time, and there's a huge delay on that. But obviously, we need to start monitoring those sites, especially if you have patients at those sites. For this purpose, we use a document called bridging agreement. So this document will allow us to confirm to the sites that all contractual obligations they signed before with previous CRO will be still respected. Sites will be fully paid. On the other hand, it will allow us new CRO work with those sites while new contract is being prepared. And like I already mentioned, in terms of site contracts, it's very important to perform the reconciliation of site payments, because again, it might be not always clear situation here. And sites, again, from our experience, sites are very reluctant to sign new contracts before they're fully paid on activities they performed before. Okay. Budget in study budget in when we have rescue study. From sponsor perspective, it's important to understand that in case of rescue study, it's very difficult, I would say impossible, to keep original budget the same, because increase will depend on the number of factors, like objective factors, just stage of rescue study, rescue scope, the status of project, in general, and documentation in particular. If you need to keep original timelines, or the study can be delayed, and it's not like the split-in budget for the task performed, which will be paid to outgoing CRO, and the remainder will be assigned to new CRO. In general, sponsors should be aware about quite a lot of extra cost due to need for a work. Also, another objective factor is overlap period, while outgoing CRO will still be in the study and already start working. So that's a double cost for this period. For the activities which started, for example, collection of regulatory documents or budget negotiations, contract negotiations, it may be still required new full budget again for this activity, simply because new CRO will need to check status of activity, what happened, and very often rectify some mistakes and fix issues. For the activities which are already completed, again the same example. For example, the IP package collection. Also additional budget might be required. So the package can be good itself, okay, but new CRO will still need to ensure it is good and still need some time to assign to this activity which was already paid for. Okay, and also significant and quite substantial budget should be assigned to study management, especially for study transit period, because like I already mentioned, that's a very critical period. When we have outgoing CRO, so we should really try to get most of it, and to obtain as much information as possible, and to perform all kind of activities while outgoing CRO is still around. So we need to assign additional resource, for example, for documents review, for contract new contract negotiations, and sign off, etc. In terms of a new budget, new contract with CRO. So from our perspective, we prefer to start under LOI with the sponsor and prepare a budget based on activities which we put in handover plan. And especially handover planning takes a few days, so this document can be prepared and LOI can be prepared really very, very quickly. In terms of cost, best approach, is to create, units and, then, create payment schedule based on units, and also to agree on some cost for certain activities which we need to perform, and then reconcile them after task is completed. Because, like I said, the assumptions may not be always correct, because we may not have full information, full picture about certain activities. So agreeing on reconciliation afterwards, may allow disappointment, and we can present timesheet hours, which will objectively indicate how much time was spent on certain activities. Likewise, with the side payments, if you need to sign a contract with vendors, we need to also reconcile payments made to vendors for activities they performed before we sign a new contract. Okay. For rescue study, CRO should assign a really experienced staff who are able to work under the time and workload pressure. It's very much preferable that team has relevant experience to either indication or to scope of the study or regions, where study is performed, etc. Team assignment should also match with timelines available for the study handover. I mean, if you have just 2-3 weeks for to take study from another CRO, then we may need to assign additional resource, extra resource, to use this time most effectively. Okay. Time zone factor is more important here for rescue studies because of very extensive information exchange. So the new team members from project management, ideally should be at the time zone close to sponsor and/or outgoing CRO. And for rescue study, we expect really very heavy senior management involvement and oversight. Okay. On this slide, I put risks which are specific to rescue studies. Like we already discussed, very often we should expect lack of information. We may not about many issues because, again, of outgoing CRO not being cooperative, and this, will lead to incorrect assumptions which we, may take. And to avoid, to address, these risks, we need sponsors to ensure really that outgoing CRO is cooperative, and outgoing CRO is provide open and transparent communication. Another risk, is complicated regulatory notifications and possible approvals of new CRO. Like I mentioned, in some countries it may be very easy. Even sponsor can notify the authority about CRO change. In some other countries, it can be done only by outgoing CRO. And sometimes you need to get approval from authority to about CRO change. Time pressure, workload pressure, fast developments. That's obviously typical attributes of rescue study. And to address to mitigate this risk, we need to assign really experienced team. Sometimes the new CRO may not be familiar with vendors working on the study and with the regions or countries where studies is being conducted. So on the one hand, again, if you choose the experienced CRO, it may overcome these issues very quickly. On the other hand, it should always ask, if CRO has experience with the study very similar to which you are conducting, and if CRO worked in the regions where you conduct your current study. Okay. For rescue study, we should expect, or we can very often may have inefficient processes and working practices. and project structure. So this should be really rectified as soon as possible, and to address this risk, we should have really experienced project managers and enough resource to change processes, to change working practices, to change documentation. Okay. Creeping budget we already discussed. It may not be always clear and obvious what will be, and we expect sponsor understanding here. So how to address this risk, like I discussed, it's best to agree on the on some expected cost, and then to perform reconciliation after tasks which difficult to assess, volume of which difficult to assess, will be completed. Okay. From zero perspective, the big risk is high sponsor expectations. So that's obvious, that's understandable, that sponsor expect when new zero comes on board, and things will change quickly and effectively, and that's actually aim of new zero. But as like we discussed already, it may be a lot of subjective factors, which cannot allow effective handover and best shape of the study, going forward. To address this risk, we expect that sponsors will be cooperative, patient, and reasonable. And to avoid disappointment, it's really best to choose experience in rescue studies zero. Okay, on the next several slides, we put some kind of action points, first, important steps which needs to be done in the rescue study. So like I already said, before triggering study handover, sponsors should do really, good preparation work in terms of, familiarizing themselves, with the current status, to obtain access to documentation, and to all, valuable information, which is maintained at current zero. Then, sponsor and new zero should assess current status very carefully. Shortly after, it should be created handover plan and kickoff meeting performed. We need zero should assign resources enough, not only experience but also enough resource, and perform training very quickly. And then inform after everyone is ready for the start. It should be announcements about zero change, and like I already mentioned, it should be really very much coordinated and planned. Okay, very critical steps should be done in terms of changing contracts and insurances, as well as regulatory notifications done according to plan. The communication between zeros should be really effective, and we expect sponsors' help here. And like I mentioned, the documentation will take time, and that's an extensive task. So this should start also really promptly and according to developed plan. Again and again, communication is always key for success of any study. But for rescue study, I should say cooperation and communication is the key. Communication and cooperation, especially between outgoing and incoming zeros, of course, with the sponsor. Okay, on this last slide, I put just kind of a summary on what could ensure the success of rescue study. So what we expect from sponsor is really proper project oversight, and that sponsor is really well prepared to hand over. Like like I mentioned, the notification about zero change should be in a really right time. We would appreciate sponsor support of the sponsor on communication during handover stage, especially during the first steps, communication to the sites, communication to the vendors, communication to outgoing zero. And we expect sponsors to good cooperation from from outgoing zero at all cost. From Zero's perspective, Zero should quickly and effectively identify reasons for rescue studies, reasons for failure, and come up with a proper action plan. It should be documented rescue process, like we already discussed, with good plan. Zero should also assign experienced, dedicated, flexible team, and again, it should be not only experienced people, but it should be really enough people to manage handover process. Of course, Zero should be very flexible and effective in communications during handover process to ensure it is efficient. And going forward, after handover is completed, Zero should develop really best recruitment strategy to manage and set management plan to ensure that the recruitment is met and timelines of the study is met. Okay, and that's all from my end today.
Thank you, Alexander, for a wonderful presentation. So I think in summary, with the right expectations and the proper planning and open communication, there's no reason why this transition process can't go well. Of course, it is a complex process, it is stressful, and it is not something that's planned for at the beginning of a trial. But hopefully you found some of the factors we've mentioned in the presentation useful today for any future planning and where you may need to do a rescue scenario. We're now open for questions, so if you go into the webinar, and please submit your questions on the bottom right hand, and we will be happy to answer those questions today. During the webinar, Alexander, I have a couple of questions which came through. First one was, which countries do you normally use for rescue scenarios when patient enrollment is low?
Okay, thank you for the question. For rescue study to rescue enrollment, especially if we have limited time, if we have really very good country, that's in Georgia. This is a great country for rescue study. It has very fast approval timelines. It has very well developed infrastructure. Sites are really motivated and cooperative. There is also the SMO in the country which covers many sites and help us greatly to get sites on board quickly and effectively.
Great. Thank you very much. Another question. Are you able to open up additional countries in the EU when a current CRO is already conducting the trial in certain EU countries?
Yep, absolutely, yes. We need to only ask sponsor about who is providing currently legal representation and EU direct number. So because obviously in this in EU it can be only one body providing those, and then we can add additional as many countries as possible as needed.
Okay. In your experience, which one of the three scenarios presented is the most common? Supplementing services, taking over whole studies, or adding new country sites to an existing study?
Probably what we did more frequently is taking over study completely.
Okay. So that's all the questions. Thank you, Alexandra. That concludes our webinar for today. I'd like to thank you all for your time today. Have a nice day. Goodbye. Bye-bye.